This segment of DelmarvaLife is sponsored by TidalHealth Home Care.
For 40 years, their comprehensive range of services to support medical patients has been unparalleled. Their personal dedication to providing the best care possible is only strengthened by the fact that they come to you.
Utilizing the latest technologies and techniques, TidalHealth Home Care is celebrating a major milestone and never compromising on quality. With us this afternoon, we've got Beverly White, who is the Vice President of Operations, as well as Robin Kokenauer, the Vice President of Clinical Operations. Ladies, thank you so much for joining us.
Thank you for having us.
So let me ask you right off the bat, why is it so important to continue the culture and the legacy of the last 40 years?
The culture of our agency has always been community, and it has been for 40 years. We are a community-based agency, and we always have been. So when what was then Peninsula Regional Medical Center and now TidalHealth, when they first started the agency in 1985, it was very small, and it was just to help a small population of the community in transitioning home from the hospital. We have maintained that culture the entire time. We have always stayed a community-based, non-corporate, and stay local. Yeah. So we have been a part of this, embedded in this community the entire time. So that is our legacy to maintain and give, is to be an active member. The biggest legacy and what's been most important to us to always take great pride in is that we make sure that every patient, and that's a big part of our whole health system here on the Eastern Shore, is that we make sure that every patient, regardless of where you live or regardless of what your socioeconomic status is, that every patient gets the same quality, high level of home care, of health care that every patient gets. So you're all treated the same regardless of who you are, and that everybody gets the same. And that is something that has always been so important to us as an agency. Right. And that has been the pillar of what we build everything we do on.
Now, as you mentioned, TidalHealth, you changed your name. You made the transition from Peninsula Home Care to TidalHealth Home Care. What has that transition been like?
So last year, we did make the decision to change our name. Many have known us as always Peninsula Home Care because that was its traditional name from 1985. As the system itself has grown over the last 40 years, we too made the decision last year to align with the rest of the health system because we wanted our community at large to understand that we had become part of what was connected to all of the providers and all of the services, that we are now a part of that natural extension, and that going in and out of different aspects of those services, home care is the same thing, and that being a part of that was just as fluid as going into the hospital or using a physician's office or getting an x-ray, that home care is such now an integral part of being a part of the whole health system. We wanted everybody to know that that we weren't a separate piece of that we were now a blended part of that same level of culture that we've maintained here on the Eastern Shore for the entire time, but same staff, same employees. And that's why I think it's really important to even share, and that's a big part for Robin. Robin is one of our original employees from 2004 when we became an active member of our partnership with the hospital, and we have several employees that are part of that original partnership from 2004.
So
Absolutely.
Robin, here's the question.
Yes.
What do you see happening in the next 40 years?
Yeah, so I'm super excited for the next 40. I probably won't be here for all of them, but I am looking forward to it. We have been able to sort of evolve and change and meet the needs of the community because it's changed so drastically. The acuity or the amount of care that people require now at home is what, as a young nurse, I was doing for people in the hospital setting. Now our nurses are doing that in the home. So everything is so much higher tech, the procedures, the processes, the needs that they have. So we are changing even now to rise to that occasion, to create educational programs to help people stay out of the hospital, to keep them well. We are training our nurses, getting them to specialize in certain training techniques so we can provide specialty care at home, like for people that come home with drains or for people that come home with advanced wound care. So we are rising to that occasion and meeting the needs, as we always have, of our community, giving that quality care. So the next 40 years for us, I feel like, is ever changing, ever growing, ever meeting those challenges of education and, of course, service, quality. You know, like I said, we've always done that, but we've really had to sort of up our game because healthcare has changed so drastically since I became a nurse that, you know, it is just, if you're not always changing and being willing to rise to that occasion, then you're not able to sort of, you know, meet the needs and be what we need to be for our community.
So you are keeping pace.
We are.
There we go.
Ladies, thank you so much. Congratulations on 40 years. And
Thank you
here's to
so
another
much.
40
We're
at
excited.
least.
Yes, thank you.
Thank you so much.
Robin and Beverly with TidalHealth Home Care.